Hello, good morning, viewers online, and those of you listening in. Welcome to another episode of the PSHAN Podcast. The PSHAN Podcast is your go-to health conversation that gives you insightful information on what healthcare is. My name is Offiong Moore, and I'll be your host for today's podcast. PSHAN brought this podcast to your homes, and PSHAN itself is Private Sector Health Alliance of Nigeria. And our aim is to leverage private sector capacities to ensure that healthcare is accessible to those who truly need them, complementing the efforts of the government. And the conversation we'll be having today will be centered around the role public-private partnership plays in ensuring that healthcare is accessible to those who really need them. Joining me in this conversation today is the delectable woman who under her leadership, has ensured that healthcare programs are targeted to communities and to people who actually need them. And our guest today will be Miss Odunayo Sanya. She is the Executive Director of the MTN Foundation, and under her esteemed leadership has rolled out quite remarkable initiatives that are targeted towards communities. And who better than her to lead us in this conversation? Miss Odunayo, welcome to the PSHAN Podcast.
Thank you, Offiong, for having me.
It's a pleasure to have you, and it's always remarkable that you at every point finds opportunity to oblige us each time we come for you, and we are grateful to have you on the podcast today.
Thank you.
Ms. Odunayo, on a more lighter note, I think I would like to know how your commute yesterday was, because the traffic in Lagos was really on another level, and for me, I got home quite late. I don't know how your commute was, but would you like sharing?
Well, I think for me, I made my decision quite early. After like 2 hours in traffic, I knew I had to turn back. There was no point just, being like a stubborn individual and keeping, in my mind, I want to get to the office. So I did turn back and I went to work from home.
I think that saves you a lot of time and stress, I must say. On a more lighter note, I like to start my conversation with asking my guests a certain question, and please oblige me, please. What are the 3 random things that you're grateful for?
I wouldn't say random, but I'm grateful for life. I'm grateful for my family, and I'm grateful for a sound mind.
Interesting. So for me, I would say that I'm grateful for sleep, especially after battling Lagos traffic yesterday. But for us at PSHAN, I'm sure we're grateful for the private sector and the efforts that they play in ensuring that healthcare reaches those who truly need them. I might seem like I sound like a broken record, but the fact that healthcare gets to those who really need them is something that we hold dear to our hearts. And I think that's one of the reasons why you're here, to also tell us from your wealth of knowledge the things that you think are efficient for PPP to work, especially in the area of healthcare. And without further ado, I think it's great time for us to start the conversation. Do you think so?
Oh, yes.
Okay.
I do.
Fantastic.
You talked about PPPs as public-private, partnerships, or some people say it's private-public, depending on the private sector will say private-public, the public sector will say public-private partnerships. But I think generally a rule in life, and we say it in Africa, if you want to go fast, you go alone. Yeah. If you want to go far, you go with others, you go with people. And a lot of times it's not how fast, but how well,
of course,
and how deep you really go. And so for me, PPPs are a lifesaver. Especially in a climate like Nigeria, on a continent like Africa. The government can't do everything alone, and private sector also can't do everything. But when we come together, then we can do much more.
Absolutely.
When we come together, we sharpen each other's perspectives. We, focus helps you to hit your target. We focus more. Everybody brings to the table expertise, perspectives, experience. And so that helps. And speaking to private-public or public-private partnerships, when you look around the world, you find that whether it's infrastructure, it's health, it's education.
Of course.
Even the Western world has benefited from, public-private partnerships. And I think more than ever before, it's a time in Africa, in Nigeria, for us to, deepen this, to become evangelists of PPPs, because the world is shifting. Funding, development funding is thinning, and everyone is making policies that favor them first. And so one way that we can leapfrog as a nation is, public-private partnerships.
Absolutely, ma'am. You've said quite incredible things that PPP can actually do. And for me, we've seen over the years private sector involvement in healthcare, and it is growing tremendously. But at the same time, we must also recognize that there's so much to be done, and there's so much we can do together. And that will lead me to a question. What do you think is needed to have an effective PPP, especially in the area of healthcare?
So, healthcare, and I know that I will still come to the question. Healthcare is a value chain, and I think people need to understand that.
Yeah.
Because the moment you understand that healthcare is a value chain, then you don't try to be Atlas. You're not going to be able to fix everything.
Absolutely.
And so when people understand, it's a value chain with different compartments, and people can focus and align with, the areas they want to move forward, then it makes it easier for private sector to come in. A lot of people look at healthcare and they will, they just say no, because it's almost like it's a bottomless pit.
Yeah.
But understanding it as a value chain just helps to, give clarity as to the fact that you don't have to do everything. But whatever you choose to do, then you must understand why you're doing it and be clear about your outcomes. And so partnerships really is about bringing people with, a high degree of like-mindedness together.
Yeah.
So why are we convening together? Why are we coming together? Checking that our values align. Clear roles and responsibilities. What do you bring to the party? What does A bring, B bring? What is the public sector bringing? What is the private sector, bringing? What are our roles? And the one way that we can achieve that is when we have, clear outcomes from the beginning.
Yeah.
So when you understand why we're coming together, then it also speaks to what we want to achieve. And so once we have that clear mapping of roles and responsibilities, trust is very important.
Very essential.
Because it's difficult to make anything of a partnership where, both sides don't trust each other.
Yeah.
And so, trust is very key. And the big picture has to be clear to everybody. We're not doing this for ourselves, but we're doing it because of XYZ. Whether it's the underserved, our communities, to secure the future of the nation, enhance productivity. So all of this have to be on the table.
You've made quite incredible insights, and your points are well spotted. I think the part that resonates with me is the part when you mentioned that partnership is more like a relationship or a marriage. And trust is really critical. I don't think there's any marriage that has thrived over decades without that element of trust. And it's one thing that we really need to speak to when we come together in terms of public-private partnerships. And this will lead me to my next question, Ms. Odunayo. You've done quite well in terms of leading and heading the MTN Foundation. And we see a lot of strides in the things that you've done, in the work that you do, in the meaning that you give to people's lives and to communities. And I would like to know, ma'am, what are the impacts that the MTN Foundation, in clear terms, have been able to achieve working within the corporate social responsibility space?
Thank you very much. And just to say, for us at the MTN Foundation, we call it CSI. And there's a reason. So we call it corporate social investments.
Beautiful.
And the reason is because we're investing in the communities. It's when you call it a CSR, it's more like a charity. But for us, is beyond that. Is about how do we enable, how do we close the gap. I was somewhere December last year, and a gentleman was saying that everything we do in life is about closing a distance.
Yeah.
So for us, it's about, how do we close the gap that we see, whether in healthcare, youth development, and a few other things that we support. So that's why for us, they're investments, and we try to monitor to see that it does have an impact, within the community, or if it's a targeted individual intervention, it has, an impact on the individual. For us at the foundation, people wonder, why do we do healthcare? Because MTN, when organizations set up foundations, it's really about, it's like an extension of deepening what they do.
Yeah.
We're telco, we're a technology company.
Yeah.
And so for us, it was beyond what we do. It was about what gives meaning to people in our operating communities. And so healthcare remains number one for us at the foundation. And over 20 years, we've done a lot. We've from when we started with taking young children, very young children, out of the country for children that had heart diseases and all of that. And then we moved into, remodeling of maternal wards. The theme of our healthcare really is mother and child.
Nice.
Because we know that, I think about, you solve about 60%, based on research, 60% of the healthcare problems we have will be solved if we only focused on, mothers and children. And so we've remodeled quite a number of maternity wards across many states in 24 general hospitals. We have, so I'll speak to a few that really touch my heart. Since inception, we've intervened in about 220 primary healthcare centers.
Fantastic.
And about in 2023, we set out to make a difference, a deep difference in primary healthcare in Nigeria, which we've always done. We set out to remodel 52 primary healthcare centers. 12 of them were in communities impacted by the floods of 2022.
Okay.
And the interesting thing for us was we could go there, dump the equipment, and just walk away. But we deepened the scope, and we had to rehabilitate the buildings. We had to equip the centers, give them consumables, give them water. And now we found that of the 52 communities that we selected, only one primary healthcare center had water.
Interesting.
And I'm sure you know that without water, it's difficult to really deliver on healthcare.
Yeah.
So we had to also install 52. The plan was to install 52 solar-powered boreholes. We provided alternative power, battery and solar, to the primary healthcare centers. We trained, and we're currently trying to enroll them in the drug revolving fund, the scheme. In all, MTN invested about 3.5 billion. We're fully done with 49 of them. We still have about 3 that we're, trying to either start or round up. And for us, the joy is the fact that we've been able to provide healthcare for mothers, especially pregnant mothers. We visited a number of those centers, and to birth at night, they don't have power. So they have to use like 4 phones, the touch lights from the phones, and it's really touching when we go there now, and the staff are happy because now they have tools to work.
Yeah.
They tell us that, they're recording lower mortality rates when it comes to childbirth. And we also had partnered with the Institute of Medical Research just as COVID hit. And they wanted to be able to further research that produced vaccines in Nigeria. And
Interesting.
they needed a particular equipment called the oligosynthesizer. And it had to be brought in and all of that. Bottom line is that the foundation enabled them to set up an oligosynthesis laboratory at the Institute of Medical Research in Yaba. And it's amazing what they've done since then. They're able to produce primers that are used for vaccines. They're able to sequence DNA. I'm not a medical doctor, but I've had to learn all these things. They're able to sequence DNA out of the body and put it back in the body. They're able to treat Marburg viruses. They're able to do a whole load of things. And that oligo synthesizer happens to be the only one working in the entire West Africa.
Interesting.
Yes. And another one that we've done and we continue to do is the Yellow Doctor Project. Years ago, we invested in the 6 mobile trucks customized as clinics, and we would go into the very underserved communities and we'll take healthcare to them. Now, people wonder, why do we do this? Now, we recognize that even though the primary healthcare centers are there, some people don't want to go because of religious beliefs and cultural norms. They don't want to go there. But the moment you bring healthcare to their doorsteps, they then get the healthcare that they need. So what we do with that is that we go to different states and there's free screening for HIV, diabetes. Of course, you check your statistics. We can treat malaria, upper respiratory tract infections, and there's a referral system. So they get referred to, either a primary healthcare center or a secondary healthcare provider. That will be the general hospitals. And so we've done this for over 10 years, the Yellow Doctor. And it's been amazing. I personally have come to know Nigeria a bit more, through some of these projects. And right now we're should I say repackaging the whole program because it's not sustainable to go on with the trucks.
Yeah.
And we can't keep investing in trucks. So we're trying to we're repackaging it and trying to leverage technology as much as possible. And then we start that again. I could go on and on, but these are some of the interventions that, we've done. I think we've committed close to over, in all, the foundation has invested about 31 billion naira in Nigeria.
It's a huge
from
sum.
inception till date across our various initiatives.
You've said quite a lot, Mr. Odunayo, and I could see the gleams in your eyes when you've said all these beautiful things that you've achieved at the foundation. And kudos to the foundation as well for
Thank you.
seeing the gap and not just working by, but then making the effort to fill the gap. And one thing you spoke about that struck me is the issue of nomenclature. At the point when you changed the word responsibility to investment, your strategic area and your strategic alliances changed almost immediately. And I think that's a very good one. It only shows us that we are limited to what we call things. And if we say it's a responsibility, then it feels like it's a burden. But at the point when we see it as an investment and an enablement, then probably we can actually attack the issue correctly. And then well done to again for all that you've said. Now, this brings me to my next question about sustainability. Corporate social responsibility, like we say, it's supposed to be the private sector's ability to fill a gap. And then we see that a lot of private sectors struggle in this area, especially in the area of sustainability. A lot of time, private sector do invest as a one-off, which doesn't really have that impact that we really need to see. Sustained impact is what would drive meaningful change. And then just throwing in a cube of sugar in a cup doesn't really change the taste of the water, except we continuously throw in the sugar every now and then we can actually say this is the impact that the private sector is making in the space. And the MTN Foundation has done really well in that space. Now, this leads me to the question itself. What would be your advice to corporates who attempt corporate social responsibilities but are unable to sustain the impacts or the initiatives that they carry on? What would be your advice to them? What have MTN Foundation really done to sustain their investments, and how can they, the corporate, leverage on your expertise to ensure that their investments as well are sustained?
Yeah, thank you very much. I think the truth is sustainability is a big issue. Whether you look at it from the shelf life of the interventions, or you look at it from, the climate, the environment, and all of that. And so for us at the foundation, we've come to realize that partnerships is the way to go, even with the private sector. Yes, not only public and private, with the private sector. And that's why I have to say that a lot of times we have to forget our egos and our logos. Private sector, we can be, my logo has to be there. It has to be my name or nothing else. It has to be. And at times you get weary. Because when you try to lift it all by yourself, it can be lonely. When you travel alone, it can be lonely, it can be burdensome. Yeah. And that's where private sector, we must come together. There has to be, and I see a lot of platforms come up, and an example is PSHAN, the Private Sector Health Alliance of Nigeria, where, it's all about driving better and improved health outcomes for, communities. And the more we can have these platforms, not replicating each other, not duplicating each other, but the more we can have platforms around education. There's also the private sector advisory group that, focuses a lot around education. It makes it easier. There's a bringing together of different minds, and you find that we're all thinking around the same thing. Now, at that point, am I willing to partner with PSHAN? Oh, yes. Am I willing to partner with someone else? Oh, yes. You understand? So through even private sector partnering, it makes it easier. So platforms for convening where, we can be members, and we are members of PSHAN. We're part of PSHAN, the PSAG, and a few others. It makes it easier. You get someone who you can work together with, and it makes, just easier on both organizations or all the organizations involved. So that's one. Number two is a lot of people run away from working with the government, but we're not going to make a lot of impact when we don't do that. And there's a lot that even the government acknowledges that the private sector brings to the table. A lot of expertise, efficiency, where the private sector is very effective, governance, risk management. Those are some of the things that, change management, that the private sector is skilled in and can bring it to the table. Whether we like it or not, government will always be the largest spender.
Yeah.
Government owns, the rich, whether it's in healthcare, education, and all of that. I'm sure we will always have more government schools than you'd have private schools. You always have more government hospitals and all of that. Now, how do we partner with government? It's very important. A lot of people in private sector might be, I don't want to partner with government and all of that. But we can only scale, and deepen the impact of what we do when we talk to government, and together we design and we deliver on, it's not easy, but if we're truly committed, that's another thing we need to do. Now, the third thing for me is about engaging the communities. So the way that we work at the foundation is if we want to do stuff around primary healthcare centers. There's a primary healthcare center development agency. There's the Ministry of Health, whether in the states or national. There are different organizations, government organizations so we bring them all together. Even the WHO, we bring together, even PSHAN, and we say, what, this is what we want to do. And we engage. So they are aware. And a lot of times they even advise. on maybe what not, how. Of course, it's up to us, but they do put in, because they also have their own experiences. And also, the very important thing is the community. A lot of times, people just say design and you bring an intervention.
Yeah.
And you go back there 2 years, 3 years after, you can't recognize the place. Then we begin to ask the question, did you carry the community along? So when we do these things, even before we start, we go to the community, we speak with the chiefs. You know, culture is a big thing in Africa and in Nigeria. So you engage the chief or the kings, you engage the women leader, the youth leaders, you know, the religious leaders, and you bring them to almost like a parliament, and you're telling them what you want to do. And it's not every community that will ask you to come in. Some will say no, and there's nothing you can do. But we found that bringing them in, it helps to sustain our projects because they own it. We're also heavy around on monitoring and evaluation. And so we found that putting a borehole in a place helps with, it reduces the disease burden in the community. It helps with, you know, the performance of children in school, because you find that they no longer have to wake up early and go to the stream to fetch water and all of that. It's amazing what it does. And then we also find that families now say they have a bit more money because now they have clean water. They don't have to buy clean water. They have potable water. Again, businesses spring up. We had a community where people started the laundry business and they began to make money. You know, and so it's a lot. We must carry the community along. And another reason for why we must carry the community along is, and I'll give an example. We had worked on vocational schools like years ago. And we decided to go back and check. And we found that a borehole of 10 years was still working and working well. And so it's not totally a bad story. Yes, well, just like every investment, it's not every investment that yields something. You know, some will give you 100%, some will give you 80, 60, some even 20, some 10, some just the way it is. But we must keep going. So I think by the time we engage the community, the public sector, we convene, we align, then we begin to see a level of sustainability. And then again, people believe when we talk about CSR, CSI, it has to be totally free. No, it doesn't. It doesn't. I recall, and I'll share the model. There are many models to this financial modeling that we can apply. About 10 years ago, we set up about 6 mammography centers and 12 hemodialysis centers in general hospitals across Nigeria. What was the model? The model was, you know, we had an implementing partner who, after MTN funded everything, but we were not making money out of it. That wasn't the aim. The foundation fully funded. What we did was to create a model where the hospital management and the implementing partner will charge a fee because we wanted this thing to have an extended shelf life, the interventions. So they will charge a fee, howbeit very highly subsidized. And it will go into an account that had the implementing partner and the hospital management as signatories. And so that will help for purchase of consumables. It will help for regular repairs and maintenance. And I know that for a long time, these centers worked really, really well. So there are various models we can apply when it comes to, sustainability, but very important is that we have to engage the public sector, the private sector. We have to convene together. We can do much more when we move together, engaging the communities, and of course, monitoring and evaluation.
At this rate, ma'am, I think you can host a masterclass on CSI. Your point resonates very greatly with what we do at PSHAN. And the fact that you talked about the holistic approach to CSI is what really draws my attention to. We've talked about the We talked about partnership with the private sector itself, even if you are a private sector, a corporate. You talked about partnership with the government through the public-private partnerships. Then you mentioned a very critical area that is largely ignored, which is a community. And sustainability, like you said, can only thrive if everyone is carried along. And I think for corporates who would want to branch off to CSR, it's very important that you adopt a holistic view of CSR and ensure that you're able to reach everyone who sincerely needs to be on the table before you start off. And the Private Sector Health Alliance of Nigeria creates that vehicle for you to jump on and creates that avenue for you to be able to reach people who you would normally not be able to reach, and that I speak towards high-level engagement. So thank you very much, Mr. Odunayo, and you've really done really well, I must say. Sustainability is critical, and a lot of times impact and investment in health do suffer because of the issue of sustainability. And this holistic approach would do us really good if corporates and of course the government can also latch on it and ensure that we drive meaningful change. Now, the question I want to ask, which is usually in the hearts of corporates, would be the issue of challenges that you have faced. And I speak for challenges, particularly with respect to trust issues, because each time PPP comes up, there would always be a conversation around a breach of trust or an erodement of trust. And it's really important because, like we said in the start of the conversation, if there's no trust, then there's no relationship. So I think I would ask my question this way. What has been your challenges itself in terms of PPP, working with the government, and how have you been able to navigate these challenges and foster trust? Because MTN Foundation itself has become a fulcrum in the area of public-private partnerships. And you've said it all in education, in health, and in other area, youth empowerment, women development, and all of that. So how have you been able to navigate these challenges and ensure that trust is fostered? Because whether we like it or not, the government is the number one in terms of public goods, and health, like we say, is a public goods. So how have you been able to navigate these challenges, ma'am?
So I think, like I said, let me just flip everything I said, lastly, flip it on its head, and maybe for public private partnerships. The first thing for us is you must have strong stakeholder engagement and management frameworks in place. It's tough for you. Government will not trust private sector if, number one, government doesn't even know what private sector is doing. Number two, private sector just does what they want to do, what we want to do, and we don't carry the government along. So the first thing for us is that we have our stakeholder mapping is clear for any intervention, whether it's health, it's education, youth development, capacity building. It's very clear. So a condition precedent to design is who are our stakeholders. Once you know, we begin to let them know when it's time to inform them, when it's time to meet with them, when it's time to carry them along. Once they're carried along, it makes it easier. And I say this, there's nothing we do that we don't try to bring in public sector, whether it's education, whether it's health. Very important. Because at the end of the day, at the foundation, what we do largely with, the public infrastructure. Yeah. Or we don't do private. We give scholarships is to people in public schools. We remodel hospitals they're general hospitals, PHCs and all of that. All of these are owned by government. So you must bring them in. And at times people, we have our own perceptions, But I think when you go into a partnership, it's very important to give the benefit of doubt. It's very important to place trust 100% on the table and say, you know what, I will trust you. But of course, whether it's the private sector trusting the public sector or the public sector trusting the private sector, there are frameworks that you work within, there are regulations that you work within, there are governance principles that you work with. And so all of those must never be compromised. And that's why I speak to the clear roles and responsibilities so it's very important for us, we continue to engage and communicate with our stakeholders, especially those in government. So that's one way, because at the end of the day, we hand over the interventions back to the government. We're not going to be there every day. It's government. The staff in the primary healthcare centers are government staff, so it's important for us. We carry, it's not easy, but we do, and we've done a good job. Government has also supported us. They don't make things difficult for us, I think another thing is, apart from the stakeholder engagement, community. We've learned how to engage the communities. The community gives us, if we want to put in a borehole, for instance, to address water, sanitation, and hygiene, the community gives us the land. So we sign, like a small deed, and they give it to us. It's theirs. So every step of the way, the community employs about 2 young people who would teach how to clean the solar panels, the batteries, and all of that. So there's a lot of community engagement, and that really it makes a difference, for us. And so another challenge will be, but not necessarily with public-private partnerships, will be, how do you sustain the funding? The foundation, for instance, is fully solely funded by MTN Nigeria, by up to MTN's 1% profit after tax. And so this has been, but in 2023, MTN didn't make a profit. In 2024, we also didn't make a profit. But because the company is dedicated and it's committed to seeing that, we contribute to, we know we can't do it by ourselves alone. We contribute to closing, the gap. So funding can be a challenge because it's the 52 primary healthcare centers I talked about. We invested about 3.5 billion. And that's why I speak to various models of funding. It could be that we're pulling together resources. So instead of you doing the same thing that I'm doing, we come together and we say we're doing it together. And that also, speaks a lot to private sector. So those are a few of the challenges we have faced. One last challenge is a lot of times you have the challenge around maintenance culture.
Yeah, you can see that.
So it's a big one in Nigeria. We've had to come up with an incentive, framework to reward those who, preserve the interventions. But we can't also say because of that, we're not going to do what we need to do. So part of it is engaging and, embedding the community at the center of what you're doing.
Well done, and quite incredible work you've done. And the challenge is itself, it's something that we should always anticipate. But the attitude we give when the challenge comes is what tells if we're going to be doing good or we're going to be doing bad. We've had quite a lot of good conversation, I must say, Ms. Odunayo. And as a wrap, I think I'll just ask the final question. I know you're very busy and we've taken quite a lot of your time. My final question would be to speak to corporates. For corporates who are willing to take on this corporate social responsibility path, or for those who see a future in public-private partnerships, what would be your advice to them?
So my advice to corporates will be that first of all, it is doable, it's achievable, and it's about what you want. Just like any relationship, is what you want from it that determines what you put in. So we are a model, and you can do it. And it's actually important for organizations to go into corporate social investments, because then you get a social license to even operate. So I'd like to encourage every corporate organization out there that is not already doing this. There's a lot of need, and you can indeed, bridge, contribute to bridging the gap. I think the second thing is that, like they say, it's impossible until it's done. There are things that we can share as the MTN Foundation. So anyone who reaches out to us, any organization, will be willing, and we do this from time to time, will be willing to share with you how we go about things. It's not, we don't hide our strategy, but it's good when we all pull together and we see the difference that we can make.
Thank you very much for your time. Thank you for sharing your expertise and for sharing your knowledge. And you have quite a lot of wealth of knowledge. So thank you for obliging us again today and being on the PSHAN Podcast. It's always an absolute pleasure to have you grace our events and grace our podcasts. We look forward to speaking with you again, hopefully on a different platform. And thank you again for coming to the podcast. And to our viewers online, it was quite a beautiful conversation. I'm sure you've been able to take on and relearn, learn, and unlearn the things that you've known. And for us at PSHAN, we offer a platform where you can actually come on board as partners, and we take on the burden. Like Mr. Odunayo say, going alone is quite burdensome and boring. And at PSHAN, we help you lift up the burden in terms of our partnerships with corporates. So please do well to click on our website to learn more about what we do at Private Sector Health Alliance of Nigeria. And for those who have listened and have viewed, please do ensure to subscribe. Please leave your comments and likes, and see you next time on another episode of PSHAN Podcast. Thank you.